Hello, I am Dr. Khalilah Jefferson DNP. Imagine this moment. You're standing in a quiet hospital room. The machines are humming softly. A family is gathered around someone they love, someone who may be nearing the end of their life, and all eyes turn to you, the nurse practitioner. Not just for medical answers, but for clarity, for reassurance, for permission. Because what they're really asking is, are we doing the right thing? As nurse practitioners, we are trained to diagnose, prescribe, and treat. But in end of life care, our most important role often isn't clinical, it's human. We stand at the intersection of medicine and meaning. And one of the most complex forces we navigate there is family expectation. Families come in with stories about strength, about survival, about what it means to fight. You'll hear things like, Mom is a fighter, Dad would never give up. We want everything done. And beneath those words is love, deep, fierce love. But sometimes that love is intertwined with fear, guilt, or even misunderstanding of what medicine can actually do. Here's the truth we don't always say out loud. Modern medicine is powerful, but it is not infinite. There comes a point when doing everything may not mean prolonging life, but prolonging suffering. And that's where our role becomes incredibly delicate. As nurse practitioners, we are translators. We translate complex medical realities into language families can understand. But more importantly, we help translate goals. We gently shift the question from, what else can we do, to, what would your loved one want if they could speak for themselves right now? And that question changes everything. Because often patients haven't said, I want every machine possible. They've said things like, I don't want to be in pain. I want to be at home. I want to be with my family. But in crisis, those wishes can get lost beneath urgency and emotion. I remember a family who insisted on aggressive treatment for their grandmother. They were adamant, do everything. So I asked them a different question. What was she like before she got sick? They smiled. They told stories. She loved cooking, gardening, sitting outside in the sun. And then I asked if she could see herself now, connected to machines, unable to speak, what do you think she would say? There was silence. And then softly, one of them said, she wouldn't want this. That's the moment where care shifts, not from caring less, but from caring differently. End of life care is not about giving up, it's about aligning care with values. It's about recognizing that a good death is not a medical failure, but a human success. But here's the challenge families don't always agree. One sibling may want comfort care, another may want full intervention. Old family dynamics resurface, grief shows up as conflict. And in those moments, nurse practitioners become mediators, guides, and sometimes even anchors. We hold space for emotion without losing sight of the patient at the center. So, how do we do this well? We listen more than we speak. We ask open ended questions. We name what's happening honestly, but compassionately. And we remind families you are not choosing whether your loved one lives or dies. You are choosing how they are cared for in this moment. Because at the end of life, the goal shifts from curing to comforting, from extending time to enhancing its quality, from fighting death to honoring life. And in those quiet rooms, when the machines are turned off and a family holds their loved one's hand in peace instead of panic, that is not failure. That is care at its most profound. As nurse practitioners, we don't just manage symptoms. We help families navigate one of the most important decisions they will ever make. And if we do it well, we leave them with something invaluable, not just more time, but the right kind of goodbye.